Conventional doctors mean well, but they're trained under a system designed to keep you sick. Unfortunately, they're not really aware or trained of how to keep you healthy because they're only trained in disease management. Here are 5 medical myths to keep you true to your health. If you're new to my channel, welcome. My name is Dr. Erica Steele. I'm a board certified naturopathic doctor. I hold 7 degrees in my field. They're all in the natural healthcare space. I like to say that I went to school so you don't have to. We have tons of content. I have done so many webinars and education. In this particular video, we're talking about aspects of the healthcare system and how to really empower you. If you're interested in learning more, I do have a webinar about the hidden dangers of the conventional medical model. So if you want to take a look at that, it is absolutely free. Go ahead and click the link below. All right, so let's get into these 5 myths. So the first one is that your genetics determine your health. So genetics accounts for less than 30%. We can thank Dr. Bruce Lipton for that research. And so we understand that epigenetics actually matters more. So what is epigenetics? Epigenetics is your lifestyle, all of your modifiable lifestyle factors. That all plays into your genetics. Now, you can have a gene that, let's say for hypertension, like nitric oxide uncoupling, and let's say it does uncouple, right, because of arginine or your nitric oxide drops too low. Do you really have that genetically? Yes. However, you can modify it by adding more arginine. Hopefully that makes sense. Definitely make sure that you don't just accept that genetics accounts for it. You push and you ask for more details. Number 2, you need medication for chronic illness. So yes and no, right? So we know that medication is a stabilizer. It's there to help us to stabilize the health of the patient if the patient just is in a disease state. However, most diseases are lifestyle driven. So we can not only prevent, but we can stabilize and in turn reverse just by knowing proper nutrition, knowing proper supplementation, and really understanding how to read your labs. Next one is the food pyramid is accurate. Absolutely not. The food pyramid is very industry driven and it's not health based. So a long time ago, Kellogg and General Mills and various different corporations in the food industry got together and worked on creating this food pyramid. And so if you ate based off the food pyramid, I'm sorry, definitely not healthy. There are so many more options. We really focus on our proteins first, then our high fiber complex carbohydrates like our fruits and our vegetables, and then various different fats, our healthy fats like avocado and healthy oils. The next one is that natural medicine isn't scientific. So that is such a misnomer and untruth and really just propaganda that's put out by the pharmaceutical industry. Natural medicine, we have a lot of science. Unfortunately, people do not take our profession seriously, and they assume that just because they've Googled or read a couple things, that now all of a sudden they understand how to treat you naturally. That could not further be the truth. We actually use a lot of science in our practice because we don't base off of bias. We don't base off of alternative medicine. We don't base off of what we think or what we feel. We base it off of the data. And so the data is what drives our decision making, whatever we're collecting at the time, because there's so many different specimens that we can collect. But typically speaking, we use the data to inform our decision making in our care so that we remove ourselves from any biases or any other types of thoughts that may get in the way of us providing care that's actually needed. Number 5, doctors always know best. So this one is very difficult, I think, because so many of us put our providers on a pedestal, with superiority bias and confirmation bias. We assume that conventional doctors know everything, and unfortunately they don't. And so doctors are not trained. Conventional doctors are not trained properly in nutrition, detoxification, and in root cause healing. They are simply trained to diagnose and manage a disease. Remember, a diagnosis is a sophisticated labeling system. And once they have a label, they are now mandated to perform standard of care. And so whatever whatever the standard of care may be, which typically is only pharmaceutical, surgery, or procedure. They typically will not go to nutrition or even nutrition supplementation. They'll go to it, as a synthetic, but not necessarily checking up on it to make sure those numbers are improving. So again, lots to unpack, lots to uncover. I know some of this content can be affirming and validating, but at the same time, very disappointing and, can elicit all kinds of fears. And so we want to empower you and encourage you. I do have a webinar where we talk a lot more, but we also give you empowering tips and tools so that you're not just kind of left out there. I do know that a lot of people have complaints of the healthcare system and they continue to do the same thing and expect a different result. And so I'm just creating another aspect where you can learn to be empowered with your health rather than reactive. So if you like my content, please like, share, subscribe, and comment below what you are doing to stay proactive instead of reactive with your health.